Okay, welcome back to FTAG Journal. This is F562, immediate access to the resident. Table of contents. We're going to do a very brief overview, go over the citation history, interpretive guidelines, surveyors, what they're going to look for, actual citations, and typically we do a summary, but this is such a short one, we are not going to go over the summary. So, quick overview. This is all about access, immediate access to the resident. It is a key element of the regulatory oversight. No one can deny access to the resident except for the resident themselves, and this one is very rarely cited. So going into the citation history, comparing 2018 and 2019, you can see that there was one cited in 2018 and only one cited in 2019. So it's not a huge concern. Most facilities know how to handle state surveyors or any state representative. And 100% of these came on the annual survey, and you'll see that in the actual survey citation that we go over. It was cited at the E level. State distribution, you can see there, it was cited in Indiana. And with the least and most cited, well, Indiana is going to be on both lists. So the interpretive guidelines, it says facility must provide immediate access to resident by any representative of the Secretary of State, any representative of the state, any representative of the state long-term care ombudsman, the resident's physician, any representative of any protection advocacy systems, and any representative of mental health protection and advocacy systems, and must provide immediate access to the resident for the resident representative. So what are the surveyors going to look for? What sort of their role in all this? Well, surveyors are considered representatives of the Secretary of State and or the state. Staff cannot prohibit surveyor access to residents, family members, or resident representatives. If they are interfered with, the surveyors, then the surveyor will consult with the CMS regional office. I've never had that done on my watch, and I would imagine most administrators have not had that done, but it certainly doesn't sound good. So what is the actual citation that was cited for this in 2018? Well, the surveyor arrived for the inspection. It was late in the evening, after 7 p.m. The administrator and the director of nursing obviously weren't there. So the facility staff escorted the surveyor to their tea room and told the surveyor, hey, stay in here until the administrator or director of nursing shows up. So the surveyor, and it didn't say how long it took, but the surveyor decided that she or he was denied immediate access to the resident. So that is pretty much F562. I think the entire video is under 4 minutes. So there's not a whole lot to it. Pretty clear cut. Should be an easy one. And that is FTAG Journal F562.